Okay. So this is a few dry needling techniques for headaches or neck pain. So I kind of find,
Yeah, whatever.
I find a muscle that has a knot or a trigger point, and then the needle goes in to help release that trigger point.
A trigger point would be, for people that are not familiar, Courtney.
Sorry, a tight knot in the muscle.
Gotcha. And so you're in her trap right now, right?
Yes.
The idea is that if there are trigger points there, it becomes tight, and then it can like pull.
Pain.
Okay.
Yeah, it's a lot of pain. And sometimes you can have knots or trigger points in your muscles that aren't symptomatic or don't cause pain. But most people have them for pain.
Dude, these are horrible. It doesn't hurt, it's just uncomfortable.
Yeah. And you've told me, Courtney, that this is not acupuncture, even though
Correct.
it can look like it.
Yes.
So what's the difference?
So with dry needling, we follow trigger points, like the knots in the muscles,
Mhm.
and acupuncture follows acupuncture points
Okay.
that go throughout the body. So I'm treating a specific area as opposed to the entire.
So the idea could be like acupuncture points could not be problematic
Correct.
sometimes, right? Whereas the trigger points usually are.
Usually are, yeah.
Okay.
You don't want me to do the front of the neck, do you? You want to put it over?
Yeah. Yeah.
Kind of like.
You want it more out?
forward? Yeah, there you go. But like, there you go. Look down, because I'm gonna do up here. You okay? Is it just achy?
Yeah.
So this one's part of your suboccipital muscles that cause a lot of headaches.
Say that again.
Suboccipital muscles. But it's a lot of tightness. It's all the muscles that attach to the base of your skull.
Yeah. Which obviously makes sense as why they would cause headaches, migraines, things like that.
Yeah. That one not bad. You've tightened this down through here too.
And when you have the needles, you're not just letting them. They're not just sitting in there. You're actually manipulating them, moving them around.
Correct. The ones
Yeah.
up here tend to just sit there
Okay.
because it's so close to your skull that
Okay.
there's not a lot of muscle tissue.
Yeah.
So, like with the upper traps, it's called pistoning, where you saw my needle going up and down, and that's kind of to get those trigger points a little bit more.
Yeah.
For this one, you can put your head kind of back on.
Okay. Can you talk through this, Courtney?
So now we're doing some cupping, which, like I explained, is those little plastic cups, and then it kind of suctions the skin up into the cup. It helps bring blood flow to the area, kind of decrease the tension in that fascia underneath the skin, and it's a feel-good kind of thing. Helps people relax.
And it doesn't hurt when
No.
when you're doing it either, even though it looks like it might.
Scrapes it over here. You don't do kettlebell swings.
All right, what muscles are you pushing on right now, Courtney?
I'm on her suboccipitals again.
Oh.
To do a suboccipitaal release to kind of add to that.
It's like the back of the neck.
Mm-hmm.
Yeah.
The base of the skull, and then her SCMs are right through there,
Does that hurt, Anna?
so you can kind
It's
of
not
grab
the
them
most comfortable thing.
and kind of pull them away.
This is totally